Hello everyone, I hope you are fine. And in this video we are going to discuss about what is tone and how it can be assessed. So first of all, let me define what is tone. So tone is basically when you are performing the passive movement and the resistance what you can feel during the passive movement, that is known as a tone. So first of all, there are two types of a tone. So we have the hypotonia and the hypertonia. So in the hypotonia, we have the decreased tone. And now I will show you what is hypotonia, how we can assess the hypotonia in the patient. Okay, so before discussing about the hypotonia, we should first look at what is a normal tone. Here you can see this is a normal tone. So as you have seen, in the normal range of motion, we cannot see any excessive increase in the resistance anywhere or the excessive reduction in the resistance anywhere. So this is the normal tone. Now let us look at hypotonia. So in the hypotonia, the patient would lose the resistance in all the range of motion. So here you can see the movement is so much flaccid. So the other person, the tester or the assessor would feel the movement very much flaccid or very much relaxed. So, or you can say the patient, the assessor wouldn't feel so much resistance in the movement or even the normal resistance that is present in the muscles naturally. So here this is the hypotonia. Now let's discuss about the hypertonia. So the hypertonia means increase in tone of the muscles. So now again the hypertonia is of the two types. The first one is the spasticity and the other one is rigidity. So in the spasticity, we see that the resistance is increased only in the anti-gravity muscles. For example, the anti-gravity muscles in our upper arm are the flexors, and in the lower limb we have the extensor muscles. So these are the anti-gravity muscles, and the resistance can be felt only in these muscles in the spasticity. Now we have the one type of the spasticity, and that is the clasp knife spasticity. And in the clasp knife spasticity, basically the cause is the upper motor neuron lesion, or you can also call this the pyramidal tract lesion. So now here in the clasp knife spasticity, we can feel the resistance only in the initial ranges. So now let me demonstrate it. So here you can see there's increase in resistance in the initial range of motion, and then the resistance goes away as soon as the end of the range is achieved. So here increase in the range, increase in resistance initially, and then it goes away suddenly. So here this was the spasticity. Now let's discuss about the another type of the hypertonia, and that is the rigidity. So the rigidity is felt in both group of muscles, that are the gravity muscles and the anti-gravity muscles, and you can also call it the antagonist and agonist. All right, so the resistance and the rigidity is felt in the agonist and antagonist, both the muscles. It means that, for example, if I'm talking about the upper limb, so the resistance would be felt in the flexor muscles as well as in the extensor group of muscles. All right, so now let's discuss about the further two types of the rigidity. So the one type is cogwheel rigidity and the other one is the lead pipe rigidity. So now let's discuss about the cogwheel rigidity first. So in the cogwheel rigidity, what we can see is that basically the cause here is the damage or the lesion of the basal ganglia, especially the substantia nigra. And you know that the neural tracts in the substantia nigra are affected in the condition called the Parkinson. So it means that in the Parkinson, you can see this cogwheel rigidity. Now let's see how we can demonstrate this. So in the cogwheel rigidity, you can see the repetitive, or you can see the alternative phases of increase in resistance and decrease in resistance. So you can call it the resistance and the relaxation phases are alternatively present in this case. So here I'm going to demonstrate it to you. So here you can see that the resistance and relaxation, resistance, relaxation. So these are the alternative phases that are present in the cogwheel rigidity. Now let's talk about the another type, and that is the lead pipe rigidity. So the lead pipe rigidity is seen in the Parkinson, in the dementia, in the ketotonic states. And here in the lead pipe rigidity, what happens is that there is increased resistance throughout the range of motion. Alright, so the resistance can be seen when the person is performing from the starting till the end of the range of motion. And now let me demonstrate it to you. So here you can see this is the lead pipe rigidity, and the resistance can be felt throughout the range of motion. So this is what is the lead pipe rigidity. So I hope that this is clear to you, and now you know about what is tone and how it can be assessed on the patients. So thanks for watching.